Hello everybody. In this video we are going to understand the difference between preload and afterload. These are basic concepts of cardiac physiology and one must know these concepts very well in order to understand the cardiac physiology well. So let's understand both of these concepts with the help of an analogy. First, let's look at preload. What is preload? Imagine you have a water balloon and you're filling this water balloon with water with the help of a tap. So let's say you started the tap. Water starts filling into the balloon. The balloon will stretch as and when water will fill into it. And the stretch of the balloon is dependent on the volume of the water that fills into the balloon as well as the force or the pressure with which the water enters into the balloon. Now let's say the balloon is able to hold 500 ml of water, but we put 600 ml into it. What will happen? The balloon will burst. This is because the balloon had an intrinsic ability of being able to stretch only to such a value that it can store 500 ml of liquid within it. When it exceeded the stretch capacity of the balloon with 501 milliliters itself, the balloon exploded. So it's the intrinsic ability of the balloon to stretch. Similarly, the heart also stretches just like an elastic or just like this balloon. And the stretch of the heart is dependent on the blood flow into the heart. The force with which the blood enters into the heart and the volume of blood entering into the heart are two important determinants of the stretch of the heart. But the heart in itself has an intrinsic ability to stretch only to a particular distance or only to a particular volume. So this stretch in the heart when blood flows within the heart is known as preload. So the flow of blood into the heart results in the stretch of the heart muscle. And this stretch of the heart is known as preload. I hope the concept of preload was clear. Let's understand afterload and compare the two. Let's understand afterload with the help of an analogy again. Let's say we have a tap and we want to fill water into a bucket. This is our bucket. Now we start the tap and water starts flowing through the pipe into the bucket. Now if we notice, the diameter over here and the diameter over here are variant. This has a greater diameter as compared to this. Let's say I remove this part, the hose, and only keep the pipe. What will happen? Greater amount of water will be able to fill into the bucket such that the bucket fills quickly. Now let's say I add the hose. In order to maintain the same speed as the pipe, in order to fill, now after adding the hose, if I want to maintain the same speed of filling the bucket like the pipe did without the hose, I will have to increase the pressure with which the water flows through the hose such that the bucket can fill at the same speed as before. Hence, this increase in force or increase in pressure or increase in work that one has to do in order to maintain the same amount of flow rate into the bucket is similar to afterload. Now let's understand afterload with the heart's perspective. The heart has to pump blood into various blood vessels. Let's say there are two different kinds of blood vessels. One is like this, one is like this. Which blood vessel offers greater resistance? Is it this or this? We all know that this blood vessel will offer a greater resistance because the area or the diameter is small. And since the diameter is small, it won't allow blood to pass as easily as this blood vessel with a greater diameter will. Hence, the force with which the heart will have to pump in order to allow blood to flow through this blood vessel is much greater than the force with which the heart will have to pump for the blood to flow through this blood vessel. Hence, the force with which the heart has to pump in order to maintain the normal flow rate is afterload. Now, let's compare preload and afterload. Preload was the elastic stretch of the cardiac muscle, whereas afterload was the force which the cardiac muscle had to contract in order to push blood into the blood vessel. Preload is an intrinsic ability of the heart. The heart has the ability to stretch to a particular volume, and that is preload. Whereas afterload is not the intrinsic ability of the heart, rather it is dependent on the vascular system of the organism. Let's say the organism has all the blood vessels constricted. If all the blood vessels are in vasoconstriction, the blood vessels will be like this, and this will offer greater amount of resistance to the flow of blood. Therefore, the heart will have to pump with greater force, and thereby the afterload will increase. Therefore, in order to summarize, preload is intrinsic heart ability, whereas afterload is dependent on the vascular system of the organism. Preload is the stretch of the heart. Afterload is the force of contraction of the heart. So I hope both these concepts, preload and afterload, were clear. That's all we have for today. Thank you.